Okay, hello everyone. I'm Joe Calderoni from Mount Sinai South Nassau, and welcome to our Truth in Medicine poll reveal. We have a very timely and exciting topic today, and that is the recommendation by the U.S. Surgeon General to affix a warning label to alcoholic beverages so that consumers can better be aware and understand of the link between alcohol and certain types of cancer. We polled on this issue in January, and we're revealing the results today. Dana Sanneman, Dana, give a wave, is going to take us through the details of the poll. But before we do that, I want to welcome everyone, and I want to thank our hosts, Optimum, for lending us this terrific space, this auditorium, and particularly Dave Widmer. Dave, give a wave. We love Dave. Dave does a terrific job, not only for the company that he works for, but for all of Long Island and for the community. He really is a community-minded person, and we greatly appreciate Dave's effort. He's also a great supporter of Mount Sinai South Nassau, and he holds the distinction. I've said this before. He's the only golf honoree. We have an annual golf event, and he's the only golf honoree to ever get a hole-in-one. So it's really a feather in his cap. Thank you, Dave. No, but seriously, Dave is a great partner, as is Four Leaf Federal Credit Union. Four Leaf terrifically has supported the poll. We could not do this poll without Four Leaf. It costs money. We hire a professional, nationally known pollster to conduct the poll, and we also spend some of their money to publicize the poll and make sure that the findings of the poll get out to the public. Four Leaf also has been with us since the very beginning. This is our 21st, believe it or not, Truth in Medicine poll. It's the only hospital-based public health poll in the metro area, and the purpose of it is really very simple: to take public health topics of importance and gauge public knowledge of those topics so that we can spur a discussion of those public health topics. So again, thanks to Four Leaf Federal Credit Union for their unwavering support through 21 different polls. With us today, we have a very distinguished panel, as you can see. Dr. Sharma, give a wave. He's the president of Mount Sinai South Hospital. He's trained in emergency medicine, but he also, he's one of those overachievers. He also has training in toxicology as well. He's with us here today. Dr. Rajiv Datta, give a wave. Dr. Datta, for many years, has been the director of our cancer center, in addition to being chief of surgery. We also have Dr. Patel. Dr. Patel, give a wave. Dr. Patel is a liver specialist and will give us her insights into this topic as well. And Ali Erickson, Ali, she is with the Oceanside-based SAFE Coalition, and they are a community-based education group that does education around underage drinking and drug use. So we're very happy to have all of the folks here today. And Dr. Glatt, who I didn't introduce yet, who is the chairman of our Department of Medicine at Mount Sinai South Nassau, also has been involved in the Truth Medicine poll since its very inception. Dr. Sharma and Dr. Glatt are basically our medical directors for the poll, and they, from a clinical perspective, help us pick out which topics we think are relevant for the public. And Dr. Glatt's going to set the table for us. So Dr. Glatt, please come up and do a little intro.
Thank you, Joe, and thank you all for coming here today. I'll reiterate the thanks to both Dave at Optimum and our partnership with Four Leaf Federal Credit Union for really making this event possible. The hospital believes that this type of an event is extremely important to educate the public. We're not only here to treat people who are sick, but we're trying to make sure that our community stays as healthy as possible. And part of the purpose of these Truth in Medicine polls is to educate our community and help them understand what are potentially important advances in medicine that can help increase the health of our community and prevent you from coming into the hospital, except maybe to say hi or to come to our obstetrics ward and to give birth to healthy children. So that's the purpose of the Truth in Medicine poll. And today's poll, you'll hear about from our panel of experts, is critically important because the Surgeon General has declared for many, many years that alcohol is an extremely dangerous product. People like to take a drink socially. However, when things get beyond social drinking of any significance, alcohol can be one of the most deadly substances that we have. I always tell people if it wasn't for alcohol, some other illicit substances, and smoking, the hospitals would be relatively empty. And over my career, I've taken care of hundreds, if not thousands, of patients who've come into the hospital with alcohol-related medical problems. These problems can be from direct toxicity, or they can be complications that alcohol causes in the body, or from, unfortunately, driving while you're intoxicated, driving while you're impaired, and the tremendous amount of trauma. There's also physical violence, domestic violence, there's loss of jobs, there's so many other social factors that alcohol can do to destroy people's lives, both from a medical point of view, from an emotional, psychological point of view, from a financial point of view, that alcohol certainly is one of the most important medical problems that we deal with as physicians. In 1998, they came out with the Surgeon General saying that women shouldn't drink alcoholic beverages during pregnancy because of birth defects. And obviously, we've already mentioned about alcohol driving while impaired and all the tremendous problems that can cause. And alcohol is a problem that affects, unfortunately, all age groups. We have children still in elementary school that have alcohol problems, and you have adults in the ends of life that still have alcohol-related problems. Almost no one is immune potentially from getting into trouble with alcohol. And most recently, the Surgeon General came out that there should be warning labels on alcohol because in addition to the myriad of medical problems that I alluded to, alcohol is also a potential cause of cancer. And therefore, the purpose of the Truth in Medicine poll that we have today is to explore that. And one of the major findings from the poll, which Dana Saineman will walk you through in a moment, is that many people realize the seriousness of alcohol consumption and have made in our poll the commitment that they will consider reducing their alcohol intake. So I've hopefully set the table for this very important poll. I apologize, I have to be back at the hospital for some responsibilities there, so I can't stay to hear all of the wonderful panelists that we have. But I will call upon Dana Saineman, who's our Vice President of Public Affairs and Development, to provide you with the results of this important poll and then open it up to questions to our panel of experts. So thank you very much for joining us today, and we look forward to hearing what the panelists have to say.
Thank you, Dr. Glatt. So initially, as Joe mentioned, this is an independent public health poll. We do hire an independent pollster. And initially, when we were thinking about this poll, we wanted to see if people were making resolutions after the new year, dry January, other resolutions, and then backing out of them. So we originally polled in January 26th to 30th, 600 adults using via landline and cell phone. And interestingly that we chose today to release the results because April is actually National Alcohol Awareness Month, and today is National Alcohol Awareness Screening Day. So this is an important public health message. Today, experts do encourage everyone to assess their drinking habits and, of course, seek help if needed, and we'll go into that a little bit more. So the poll asked, which best describes how often you drink alcohol? Occasionally, 26%, rarely, 26%, weekly, 19%. How many drinks do you consume in 1 week? And you'll see 36%, 4 to 7 in 1 week, 21%, 1 to 3, and 22%, 8 to 14. And, let's look at that red on the pie chart, 15 or more, 14%. So some key findings, just under half, so 46%, of poll respondents have heard something about the Surgeon General's advisory. And just over half, a majority of New Yorkers say they will consider drinking less due to the Surgeon General's warning about the link between alcohol and cancer. 54% say they generally believe warning labels on food and beverages. And weekly alcohol users are less likely than average to believe the warning labels. 46% believe alcohol use can increase the risk of cancer. That's a big number. 26% do not believe it at all, and 28% are not sure. So we see these numbers as gaps and a need for more education. Other key findings, 58% agree that alcohol can lead to overeating and smoking, which can also increase one's risk for cancer. 58% also agree that there is a safe level of alcohol that can be consumed without raising one's cancer risk. 54% do generally believe warning labels on food and beverages, so we've seen warning labels on other items before. Have you heard about the Surgeon General's advisory calling for warning labels on alcohol? And do you believe alcohol use can increase your rate of cancer? Almost half. So a few other important messages from the poll, and I think Dr. Patel is going to speak to this a little bit more. About COVID, 5 years ago, there were studies that showed an increased use of alcohol during COVID, and now 5 years later, what we're seeing, the impact on health. Women under the age of 50 who drink at least one drink an average, drink an average of 10 drinks a week. The overall average is about 1 drink per day, or about 8. While women are more aware of the Surgeon General's warning than men, and are more likely than men to believe alcohol use can cause cancer, there is more education needed for women looking to decrease their alcohol consumption. Most people who consume alcohol believe there is a safe level that would not increase cancer, so initial efforts to promote drinking less rather than stopping it might be better. So your dry Januaries or other kind of trends. Dr. Ratal will speak a little bit more about this, but there are 7 distinct types of cancer that are linked to alcohol use: breast, colorectal, esophageal, voice box, liver, mouth, and throat. There are local resources, and we'll speak to this a little bit more, that you can turn to. Speaking to your physician, outpatient counseling services. But on Long Island, there are several resources. They're listed on the Nassau County Department of Health website. There are several resources that you can turn to if you believe you have an addiction problem and need help. I would just like to play just part of our partnership that we have here with Optimum. We did put together a 30-second TV spot that you'll be seeing. This is just to continue our campaign around education with alcohol use, so I'm just going to play this quickly.
The truth about alcohol. The Office of the U.S. Surgeon General has linked it to cancer, breast, liver, throat, colon, mouth. The Surgeon General wants a warning label, but will it change what you do? 51% of New Yorkers say they'll drink less, according to the latest Mount Sinai South Nassau Truth in Medicine poll, sponsored by 4-Leaf Federal Credit Union. Will you? Learn more at southnassau.org/truthinmedicine.
Okay, we'll start our panel discussion. Please feel free. This is meant to be interactive. If you have questions, raise your hand and we'll get a mic over to you. Thank you.
Thank you, Dana. Everybody can hear me okay? So we're going to dive right in. We got a lot of firepower here on the panel. Dr. Sharma, I'm going to start with you. I want to draw on your toxicology background. So, we've heard a lot of conflicting information as consumers about alcohol. We've heard for years, a glass of red wine, it's actually good for you. It might help your heart health. And I think we see from the poll, roughly half either don't believe that there's a link between cancer and alcohol, or they're unsure about it. And they say, come on, one beer is not going to hurt me, one glass of wine, what the heck? This is New York, after all. We got bars galore. What is the risk? What is the science behind the link between cancer and alcohol?
That's a good question, Joe. So there's definitely a risk. There's an agency called the International Agency on Research for Cancer, IARC, and they have a charting system that looks at every chemical that humans can be exposed to. And they have a four category system, so it's 1 through 4 essentially, as a 2A and 2B. But anything that's a category 1 is considered a human carcinogen. Now think about how hard it is to get to a category 1. There has to be evidence in humans that it actually causes cancer. Alcohol is a category 1, IR category 1. So other things on that list are radiation, which we know causes cancer, benzene, which we also know causes cancer, tobacco, which we know causes cancer. So the items on that list have demonstrable scientific data to show that they are linked to cancer in human beings. Things below that list, there's sometimes risk in animals, there's sometimes no established risk. So to get to that level 1 risk, it has to really be established. So there's no doubt that alcohol causes cancer. And Dr. Datta is going to go into a little bit about what type of cancers and the risk associated with drinking. Now, the World Health Organization decided to understand a meta-analysis. A meta-analysis is where you take all the papers published on a given topic and you analyze them almost as one big paper. And they looked to see if they could determine what is a safe level. So speak to the 1 glass of wine per night to help with the heart. They could not establish a safe level. That means there's no data to support that 1 glass of alcohol a week is harmless. It doesn't mean you're going to get cancer definitively, but it does mean that you have a risk associated with that. And what I'll liken it to is some people smoke 20 cigarettes a day, a pack a day. Some people smoke 1 or 2 cigarettes a day. Their risk for cancer is different, but it's not zero. And if you don't smoke cigarettes, the risk for the cancer associated with smoking cigarettes is 0. And that's basically the translation. So there's no safe level that we can suggest. It doesn't mean that you're going to get cancer with every drink, but it is a cancer-causing agent. And I will say it is a little concerning that a significant percentage of people we poll don't believe that. It's just a disregard to any of the evidence that's available for people to use in their information decision-making.
So, Dr. Datta, let me turn to you next. You are Chief of Surgery at Mount Sinai South Nassau, in addition to being Director of the Cancer Program. What types of organs are impacted and linked to possible alcohol use?
Sure, Joe. So when you look at the causative relationship, just like Dr. Sharma mentioned, we found mouth, throat, voice box, esophagus, which is a food pipe, liver, colorectal, and breast. These are the ones which are definitely associated with alcohol intake. If you look at the data which came out in 2020, based on all the analysis, almost 100,000 cases were linked to alcohol, out of which 20,000 deaths were caused from alcohol. Now, just to give that in perspective about the knowledge, if you ask anyone, does alcohol cause cancer? Based on your poll, majority will say no. But you ask anybody, can alcohol cause drink and driving accidents and death? They will say yes. If you go back to the numbers, 20,000 were from alcohol causing cancer, but only 15,000 were from alcohol causing accidents. So there is a big gap in knowledge base. The second part is that alcohol causing cancer can cut off the life by 15 years. That's what the alcohol caused cancers can do. And the third part of this is that, going back to what Dr. Sham was talking about, what's the minimal drink? If you look at the CDC paper today, they will tell you, don't drink. If you have to, drink maybe 1 or 2 drinks a day. So let's look at that. Let's say 1 drink is, everybody thinks is acceptable. If you look at the 100,000 cases, 85% of the cases were when you had 2 or more drinks. However, the 15% were from the population who had 1 or 2 drinks a day. So even that can cause problems. And the way it causes cancer is, we know 4 ways. One is it converts into poison, the acetaldehyde, which damages the DNA of the cell. Second, there's an oxidative process, which again damages the DNA. Third, in females, it affects the estrogen, which is the hormonal level, causing breast cancer. And lastly, it works with the other solvents, such as tobacco, and that can cause cancer.
So, Dr. Datta, we spoke earlier, and you mentioned in terms of the education, I go in for my annual physical, and they ask me all kinds of questions, and they, do you drink? I say, yeah, I have a drink a night or once on the weekend, and that's it. It stops there. So talk about physician education.
Yeah, so we have to do a lot of education. It starts with the physician, then the population. As you can see, the tobacco took decades, about 4 decades to teach everybody. Today, everybody agrees tobacco is a risk factor. Alcohol is not on the radar right now. So to your point, if you go to a physician and you're taking a history, do you smoke? No. If you say you smoke, they're going to start talking about smoking cessation plan. But if you say, how much do you drink? Oh, socially. Next question. Nobody even stops you to say, what is social? You know, you could be social 3 times a day. Who knows? You know.
I'm a very social guy.
Yes. But so nobody even questions that part. And that's what we need to do. So we're starting with the physicians to interrupt the patient and say, even 1 or 2 drinks a day is not good.
Dr. Patel, let me get you in on this. You are a liver specialist. You help patients before they need a transplant and hopefully help them avoid a transplant if you can. When we were speaking before, you mentioned that, in the public's mind, if I have a real serious alcohol problem, I got to go to detox, I got to go away for a month, I got to risk my job. But you were telling me that there are other alternatives, medication. You want to speak to that?
Yeah. For each patient, you need your own approach, and there are patients who may require inpatient or outpatient detox. But what we see in our office oftentimes is what we call functional alcohol use disorder, meaning people go to work, they do their responsibilities at home, and yet the alcohol consumption on a daily basis is significant enough that it's leading to liver disease and other poor outcomes. These patients oftentimes, we see TV, movies and stuff, and we see these horrible depiction of alcohol use disorder. But most of the patients that come into the office are not those patients. They're there, but they're not all of them. And not every patient needs inpatient or outpatient detox. If you speak to your physician, there are medications available that will help actually reduce cravings if you feel as though you have a problem with alcohol use. There's several medications out there. Furthermore, a lot of times alcohol use is a way to treat underlying anxiety and depression. So again, these are conversations to have with your physician, because sometimes we treat the anxiety and depression, and a lot of times the alcohol use actually goes down substantially. So not every patient has to go to detox. There are those who do need it, and we're glad that we have several programs available in and around New York City and Long Island. But start the conversation, and there are many options available to get help.
At Mount Sinai Hospital in the city, we do liver transplants. How many a year? And they're not so easy to get.
Alcohol-related liver disease in the United States is actually the most common reason for liver transplantation in the United States. Alcohol-related liver disease is also the vast majority of liver-related deaths in the United States. So in the last 20 years, we've seen a threefold increase in how much alcohol plays a role in liver transplantation. Unfortunately, we still have very long transplant waiting lists, and therefore, we try to attack the problem prior to transplantation. But we are fortunate enough that we have a very robust liver transplantation program, both for acute alcohol-related liver failure and for chronic alcohol-related liver cirrhosis.
So if I'm thinking, hey, I'm just going to drink whenever I want, and I can always get a new liver, that's not the answer.
No, and it's one of the biggest surgeries and procedures you'll ever undergo. And the story never stops after transplant. It requires months and years of seeing doctors, being on immunosuppressions, and transplantation has its own risks associated with it. So it's fortunate that we have that as a solution, but it should not be the solution that one is trying to achieve.
So, Allie, let me get you in on this now. You are on the front lines. You see people every day who come in and seeking help, and also you provide a lot of education, I imagine, at Oceanside-based SAFE. We are seeing some positive trends among some of the generations. We've seen an increase in non-alcoholic beers and wine, and even I read about a bar in Brooklyn that is only serving mocktails. So there seems to be a generational difference. What are you seeing?
So from our standpoint, what we collect data on for the Oceanside Safe Coalition, we are prevention-based. So we try to increase education and also just try to increase community buy-in and community education as it pertains to underage drinking, and kind of change those societal norms as they pertain to underage drinking. So we're really looking at the big picture, not just like one small facet of the community and focusing in on that. So that's the big thing with community change. When I'm looking, what we see for what we've collected on our end is we do see over the last couple of years, there was a decrease from the age group that we are collecting data from, which is middle school and high school students. And there was a decrease in binge drinking, and there was a decrease in past 30-day use. And there was also a notable increase in perception of risk. So I do think that it is important, and it is important to take note of that. And yeah, I mean, you look around and you see there's kids drinking more water. They're paying more attention to their skincare routine. So hopefully there is a little bit more education coming out. And we love to see that from a prevention standpoint, that hopefully there is kind of a little bit more of a health craze, and it's kind of impacting them a little bit more. They're taking note. There's an increase in technology use and information coming out that way, what's trendy. And I think that youth are very, susceptible to that. So there's something to be said about that for sure.
Very good. Dana, you are the mother of two almost teenagers, right? How do you view this topic, and what are you going to do in counseling them?
Well, I do want to go back also to Ali and Dr. Patel, because I think we did learn a lot during COVID. 5 years, especially in the beginning, people were home a lot. They were doing their best to socialize outside. And I saw in my own community a big increase in drinking. And to Joe's point, we are on Long Island, we're in New York. There's no shortage of bars on every corner. But I think Ali has some good insight on community trends that she should speak about. And Dr. Patel, I was really interested in what you were saying 5 years later, now what you're seeing in your patients post-COVID, especially in women, and that was one of our more important findings as well.
So, Dr. Todd, let me just come back to you about breast cancer. So is there a specific link to alcohol use among women and incidence of breast cancer?
Yes, so when they looked at the data and analyzed, what they found is that 16% of the cancers are directly related to alcohol. So you can imagine you can cut down not only the cases, but also deaths because of that.
Would you give any advice to women in general?
Yes, so,
Different than men?
no, it has to be the same for both, because alcohol causes cancers in men from mouth, throat, esophagus, which are common organs called rectal. Women have a higher incidence of breast cancer anyway. So when you take a history, right, you stratify risk for the patient, you take the family history, you take the hormonal history, and the alcohol history is part of that.
Dr. Sharma, I don't want to get too political, but my understanding is it would take an act of Congress actually for the U.S. Surgeon General, and it was the former U.S. Surgeon General who made this recommendation, for that to actually be enacted to have warning labels on alcoholic beverages. What do you think the chances are of that happening?
I think the chances certainly are slimmer than they were. As we saw in the survey, people do believe the labels for the most part, and they're helpful educational tools for consumers to make informed decisions. So I am worried that it may be stalled. But what's important is that the conversation has started. And I do want to distinguish, we've been talking about two items here. One is alcohol-related cancers, and one is alcoholism or alcohol dependency. Those are two separate conversations. And if we start to make the mistake that only folks with alcohol dependency are at risk for cancer, we're going to miss the major part of this issue, which is that alcohol causes cancer, and consuming alcohol in increasing quantities, even if you're not dependent, increases your risk of all those types of cancers that Dr. Patel mentioned.
So, Dr. Patel, just pick up on that, because when we spoke before, you mentioned that, and I'm not a clinical person, you mentioned that the liver has no nerve endings, so there's no, warning signs. It's not going to start flashing lights at us. Talk about that.
So oftentimes, this is something that I see in my office all the time. Patients come in with advanced liver disease, and they're often shocked that they had no warnings. And many times there is no warnings. The liver has no nerve endings itself. The capsule around it does. So you could be damaging your liver for years, whether it's from viruses, alcohol, and have absolutely no idea that your liver is undergoing this chronic state of inflammation and scarring. And when that scarring builds up enough, and we call it cirrhosis. It's only when cirrhosis leads to liver failure that patients finally oftentimes present to my office. Many times at that point, we are looking at liver transplant, and in some cases, the mortality goes up. Mortality rates are 5-year survival by the time you're decompensated liver disease from alcohol is 35%. And so because the liver doesn't have nerve endings, oftentimes we miss patients. I often wish that, it would lead to at least a fever or some pain, because then they would show up to my office early on for us to intervene. And women do process alcohol differently than men. At lower concentrations, we see significantly more damage to the brain tissue, higher risks of blackout. Alcohol-related liver disease presents in women at almost 5 to 10 years younger than men, and it's actually one of the fastest, again, rising indications for liver transplantation in women. Women have less of the enzyme to digest alcohol. Estrogen plays a role in how we tolerate alcohol, and it also is the water content. Women have less water content of their body, so it's concentrated. So I think that with women, we do see the toxicity, especially with the liver, at lower doses and at a younger age than we do see in their male counterparts. But yeah, unfortunately, the liver doesn't complain much until it really starts complaining, and then the quality of life really drops drastically.
Until it's too late. Allie, you're involved in education. So, not that long ago, we all were subjected to commercials for cigarettes. We all saw movies in which every Hollywood star had a cigarette. Smoking was cool. It's not so cool anymore, but drinking is still pretty cool. I mean, we got a lot of commercials on the air, Budweiser, whatever, Super Bowl commercials. Social media also, I imagine, is a factor. It's a social thing. How do you combat that? How do you convince young people that maybe it's not so cool?
Joe, and to also point out, when we were all younger, alcohol didn't taste good. Now there are so many alternatives that actually taste good, so there's another challenge.
I think that's why it's so important to note that although messaging can be such a powerful tool, correct? And the fact that we even saw in this poll, individuals said, yes, of course we would consider, reducing our alcohol intake, but then you also had a majority of the individuals that were polled that already knew the risk, that already knew the Surgeon General's warning. So did they already reduce their risk, or would they consider now, and why didn't they do it before, or do they feel like they have? So there really is, it's not just the messaging. A lot of other things need to change as well. So when you look at a community perspective and community change, an actual sustainable community change, you really have to attack that in a multifaceted approach. So it is education, it's reducing barriers to care, it's reducing access to the substances themselves, the messaging, of course, but then also that policy change is really huge. That really needs to follow that sustainable change that people do want to see. And there's, the fish in the polluted pond theory when it comes to children, and really anybody in communities. You don't remove the fish from a polluted pond, you treat the pond, you treat the environment. So it's really going to take a societal change in really reducing those social norms. And our youth themselves, even in our last youth development survey, they noted that societal norms and laws favorable to drug use and alcohol use are the biggest risk factor for them when it comes to substance abuse.
Polluted pond, okay, I'm gonna pick up on that. We do want to leave time for some questions. Anyone have a question in the audience? We're happy to entertain them. We got some great experts here. I think we got a mic that we can pass around.
You didn't mention the one-time disastrous effect that alcohol can have. Somebody who's never drank before has a couple of drinks, and then all of a sudden they're making a very poor choice, engaging in sex, trying drugs for the first time, etc. I think that's something that has to be addressed. I go to a lot of dinner meetings, and there's a cocktail hour before. I have like a tonic and a lime, just so that I have something in my hand, and people aren't, like giving me that look. Are you not drinking? That's risky behavior. But I think we have to, tell people how dangerous alcohol is all the time. Not just habitual or daily, but one time can be one time too many. Yeah, hi, I'm B.A. Schoen, and I'm a board member at Nassau BOCES.
So it's a great point. Dr. Glad did comment on how the hospitals would be empty if it weren't for alcohol and other substances. And a big portion of that is the impaired decision-making associated with inebriation. Our challenge is going to be that alcohol is such a widely accepted substance, right, that a temperance approach is not going to be effective. We saw what happened to this country the first time that happened. It was very divisive. What we really need is education and for people to make informed choices. We need enforcement. As we saw with smoking, we can get there. It takes some time, but certainly until vaping kind of popped up out of nowhere, children were smoking much less in high school and middle school, and adults were smoking less. But what did we do? We took smoking out of bars. We took smoking out of restaurants. We took smoking out of all the places where it was social to smoke. Taking alcohol out of bars, it's going to be hard to do, right? So we have to come up with a different approach, but with the same concept. That it's education based. It's going to be a slow moving process, but that we have a long-term goal, and it won't happen overnight.
I'd like to touch on that as well too, but I think you have a very good point too when it comes to especially educating youth. We have to look at the development of the underage brain itself as well. They're not going to be looking at the long-term effects of alcohol or the long-term effects of how substance use can really damage them. We know as professionals, we know as adults, hopefully we know as adults, that the earlier that you start using any substance, the more likely you are to develop an addiction or any type of addiction when it comes to using any type of substance. So I think that when you're educating youth and when you're talking to youth and when parents are talking to youth or when the community is addressing certain substance use when it comes to youth, they're focusing more on those short-term impacts of really what could happen when they are abusing or if they are using frequently. That is a more impactful approach when talking to youth, is focusing more so on those short-term impacts, really letting them know also the long-term impacts, of course, and what can happen in the long term. But I think that that's what's going to be the most impactful for youth is that short term, because that's really what they're going to be able to absorb the most.
Allie, has the legalization of marijuana impacted your efforts? Is it harder in the polluted pond?
I mean, it certainly didn't help. If you look at data in other states that have legalized, you will see that, in turn, there was, a higher increase in youth usage. The more that something is normalized, the more that, we're putting across that this is legal. You're, at the same term, you're also kind of sharing that message that, well, if it's legal, then it must be safe. It must be something that we can do, even though, it's not something that is obviously recommended for use to begin with. But especially in today's THC levels, they're not the same as they were 30 years ago. You're looking at some products, some of these synthetic products are 99% THC. You're looking at increases in hospitalizations. You're looking at increases in people developing mental health disorders and schizophrenia. So that information really needs to be at the forefront as well. And we try to do that, from a prevention standpoint and really educating and, again, limiting access and making sure that in Nassau County, we opted out of individual marijuana sales. But that's not to say that it's not still being sold. And we really have to kind of stay on top of that and make sure that it's not being sold, it's not being made accessible, because even though it may not be something that is as readily available or should not be as readily available in Nassau County, it doesn't mean that it can't be accessed. So we really have to make sure that we're still following up with our lawmakers and making sure that they understand the effects that have happened in other states and how that can negatively impact us and our youth. So it's important.
There's no border patrol between Queens and Nassau County. Right?
Exactly.
You go right up to Queens and buy some pot. Any other questions from the audience, please?
I'm Greg Davis. I work with Optimum Media. But two questions. You said about the liver that you can't detect. When people go, men or women, for their annual physicals, when they do blood work and all that, is that checked in there in any way?
So part of the annual physical, there's always a liver panel of blood tests, right? So your annual physical usually includes checking the liver, the kidney, and your blood counts, most often along with your cholesterol and your diabetes. But not all chronic liver disease doesn't have to present with elevated liver tests. if the tests are elevated, it's definitely something that needs to be investigated further. But no, just because you have chronic liver injury, you may not be picked up on that blood test. So again, more reason to have that conversation with your provider if you do feel that you're having alcohol in excess, it's affecting your life. And even if it's not, and you're just curious, doc, how much, this is how much alcohol I drink. Would it impact? It is a conversation starter, but no, you may not pick it up necessarily. Even patients with chronic hepatitis C, chronic hepatitis B, viral infections that patients have for years, your liver enzymes may be completely normal. Fatty liver disease, completely normal, so not necessarily.
Okay, I just wonder if there's something that can be done as far as your physicals go. This should be changed, but going forward. Now, in all these tests on alcohol, I mean, I'm a baby boomer. Alcohol was our life, right? I mean, my parents and everything else, nobody thought twice about drinking. Now, I'm a light beer drinker. My wife drinks Merlot. My son, he likes the harder liquor. Differentiations between the three, I mean, as far as the seriousness or effects?
So at the end of the day, for the body, it's pure grams of alcohol. So it's 14 grams of alcohol is what the equivalents are. So typically, a 12-ounce beer is equivalent to a 5-ounce glass of wine, which is equivalent to about 1.5 ounces of 40 proof alcohol. So at the end of the day, the machinery of the liver looks at, it's like a manufacturing warehouse. There's toxin that comes in, it detoxifies it, and hopefully sends less toxic substances to the body. So for the liver, it's looking at grams of alcohol, and so it's 14-gram equivalents of alcohol is the way to look at it. So whether you're having, so your bottle of wine versus a couple of cans of beer, it doesn't care about that. It cares about the pure grams of alcohol, which is 14 grams is considered a standard drink.
Dave, you're not going to ask a question on this?
Hi, Paul Souza with Optimum Media. You had mentioned a connection between breast cancer and alcohol. Any other types of cancers specifically that it's connected to?
Yes, so it's mouth cancer, throat cancer, esophagus, which is the food pipe, the voice box, liver, colorectal, and breast.
Thank you.
If you think about the route alcohol travels through your body, it's that basically whatever it touches, as Dr. Patel mentioned earlier, it causes oxidative injury, the alcohol itself. Once it gets to your stomach and your liver, it starts to be metabolized, and then you get these toxic metabolites, acetaldehyde, which is, formaldehyde, you probably heard, is a cancer-causing agent. Acetaldehyde is in that aldehyde group, and it's also a cancer-causing agent. So, and then the breast is through circulation. But most of the cancers are direct contact sources.
Dr. Patel, when we were speaking earlier, you did mention some advice. We do live in a society where people drink, right? So the idea that people are going to walk out of here and they're not going to have any alcohol anymore is probably a bit of a stretch. But you had some advice in terms of moderation and drinking over a longer period of time rather than downing it all at once.
So again, toxin-wise, it's a toxin, right? So the question is how much toxin? Ideally, none. But if you are going to consume alcohol, it's often best to do, for women, 1 drink over a 2-hour span. For men, no more than 2 drinks over a 2-hour span, right? It's just like, even consuming food. I often tell my fatty liver patients, our society, we're in such a rush to finish everything. If you actually slow it down and pace it out and have it with food, there's some data that perhaps there'll be a little less effect on the digestive process. So the liver will have a little bit more time to digest the toxin. It's again, if you look at it as a factory, if something's coming in too fast and the middle guy's slow, you're going to build up the toxin. So ideally, 1 drink over a 2-hour period, no more than 2 drinks per night for a woman, no more than 3 drinks per night for a man, and ideally span over a 2-3 hour period if you are going to consume alcohol.
So moderation is still a good message, and you said also, I think, to eat something as well, right?
There was a small study years ago out of Europe that perhaps eating food with consuming food and alcohol together may reduce it. I don't know the exact quality of that study, but it probably will help you slow down the consumption of alcohol if you're rather than just doing the alcohol alone.
All right, so I'm going for the beer nuts. Okay. All right. Any other questions? Questions from the audience before we wrap up? Going once? Anyone on the panel have anything they want to add? Very good. All right. Well, thanks, everyone. We appreciate the time. Again, thanks to Optimum, thanks to Four Leaf, and thank you all for coming.